All right, great. Okay, so this is 12 application writing tips, and I'm Dr. Sunny Nakae, and this is July's pre-med chat. So the first rule for writing is to capitalize. So I see this a lot in AMCAS applications and on just various materials. Make sure that you attend to grammar rules and that you capitalize proper nouns like your name, your street name, your state, things like that. Do not write in all caps. And if you don't capitalize properly, sometimes it can just look lazy. Also, this information goes directly into our student record system. So if you don't capitalize your name, then it will appear that way on future rosters and other information regarding the school. Second tip, very similar, is grammar. So make sure that you are careful about how you're writing. Pay attention to the grammar of your essay to a certain extent. You don't have to write in super academic kind of journal style, but this is sort of considered attention to detail. So we do want to see that you know how to express your ideas clearly. Generally, you don't have to write in third person, like one would learn or one can understand. You should just say I. And also watch your passive voice, which is sort of like the goal was accomplished in 3 months versus I accomplished the goal or we accomplished the goal. So looking at your tense agreement for subjects and verbs, and ending sentences with prepositions like of or about, just make sure that we're considering those things. These are all just attention to detail pieces that can really help your application be sharper. Criticism. Do not criticize or be excessively judgmental in your writing. If you are talking about something that you saw that a physician did that you think was poor or should have been done better, then you have to write about it very carefully, because typically you will have several physicians involved in the admissions process that are reviewing. You also just want to be careful not to criticize other professions. You're not a part of it yet. And so recognizing the complexities and the challenges, valuing multiple viewpoints, it's a way that we kind of can look for maturity in an application. And professionalism means that you can, apply some restraint and some decorums, some behavioral norms to be careful about what you say about other people. So thank you notes. I get a lot of questions often about thank you notes. My only rule is if you're going to write them, that you can make them personal and meaningful. They're certainly not required. You can send them via email or snail mail, whichever you prefer. These are part of your application and your candidacy. So many schools will put the thank you note in the file or might send it to the committee. So don't write it because you think that you have to. Avoid overstating, like, this is my #1 school, or you guys are the best, only if you really are meaning it and it has some sort of connection to a person that you might have met along the way. Letters of continued interest in updates are appropriate. So you want to use the applicant portal system for the school to send those, or the general email address for the admissions office. You should be communicative about your interests, again, without being super over the top. Usually unofficial transcripts are fine. If you have a grade update that you're sending, you can just let us know what your grades are. We don't expect you to send official transcripts to us. And in fact, we don't really do anything with official transcripts until the very end of the admission cycle, when there's going to be matriculation. So feel free to send your updates on activities and grades to the admissions office. This is what I like to call the donut for personal statements. So the biggest mistake that applicants make is to discuss all their experiences and essentially say, I did all these things because I want to be a doctor, and I want to be a doctor because I did all these things. And there is no why involved in the essay. So we need to know what your experiences mean to you. We need to know how they've shaped you or challenged you and helped you become aware of the world. We need to know who you are and why you're choosing this as a profession. It should be a personal statement, which means you couldn't put it online and a few people could change a couple of words and make it their personal statement. It needs to be your story. So the meaning-making part is what really can make it unique and can make it yours. Do not just report on or observe yourself in those experiences. Right? I went to the hospital and I worked with students and it felt so good, and I worked with this doctor and it was great to be so curious. Those are all observations. What does it mean? being a part of the research process for me means, or working with patients in this way means. We want you to really tell us the why and the meaning making. A caution about repeating and recycling content, especially just word for word. So do not repeat essay or statement content from your AMCAS application on your supplemental. We do expect them to be different, and we read them side by side. So as your application progresses through the process, all those components go with it. So we will read your AMCAS and then we'll read your supplemental, or vice versa. So if you have exactly the same essay in one or the other, you just look lazy, like you missed an opportunity to tell us something about you that could have really helped your candidacy. You can still write about the same experiences. Maybe you have something that's really meaningful and you write an essay about that in your most meaningful, and then you expand on it or revisit it in a certain way or include it as one of the components of your personal statement. That's okay. But cutting and pasting is definitely a no-no. And then for supplemental applications, you are supposed to be specific. Think of your supplemental as a love letter to the school. So if you use generic stuff, we can usually tell. If you pivot and answer a question that you want to answer rather than the question that we asked you, we can tell. Typically, this is where schools are going to assess their mission and ask specific questions related to their mission. So use it as an opportunity to give specific information about yourself to the school. Avoid being generic. So generic writing won't hurt you, but it certainly won't help you stand out, right? So you can write a really safe kind of, I did all these things because I want to be a doctor, blah, 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 kind of personal statement. And we're just going to skim through it and go, okay, next candidate, right? So if you start to say things like, I like helping people, I like science, and I like people, so medicine is like puzzles, right? All these things are very generic thoughts and concepts about medicine. So if everyone could write it, again, it's not personal. So you do want to think of themes and make meaning of your experiences so you can write something that speaks to who you are. You can use first person, as I said, but you do want to watch how centered you are within your statement. I was just helping a student with a residency personal statement last week, and the student was really talking about how they were so excited to go into pediatrics, and this is what they're going to do, and it's going to be so rewarding, and I'm hoping to do all these things, but there wasn't a lot of attention or details around how the student interacts with patients, or what it means to, be an interpreter in clinic, or why that's important, or barriers that the student wants to help patients overcome. If you are situating yourself at the center of it as the person who's going to be the hero, you're going to experience all the rewards, you're going to save the world, that is not a very mature or appealing perspective for you to be taking in your essay. So think about your lens that you're using for your writing, and are you being other-oriented in this writing? Are you showing multiple perspectives, or are you just as the hero situating yourself in the middle? So I'm a fan of combinations on AMCAS applications. I think there's really clever ways that you can combine, say, customer service jobs or a lot of health fairs that you might have volunteered for in order to just get more real estate out of those 15 experiences. It's completely fine to combine them into one and then to list beneath just the descriptions and information about what you've done. I recommend only using the hobbies once. So do not list 5 hobbies that you play the cello and you train for marathons and you bake cheesecakes. And this is your professional resume that you're submitting to AMCAS. So you should be putting things in there that you think are relevant to your professional journey. And I do think being well-rounded includes having some hobbies that you are pursuing, but do not use it too much. The experience list, if you have an organization that you've done several experiences with, you can make a choice about how substantial that is to separate it into something else or to include all of them underneath one heading. There has to be enough hours and differences in the things that you're doing in order to justify really listing it twice. Otherwise, we start to see the same organization and hours underneath it, and we wonder if you're listing the different leadership experiences. So I'll give an example. So maybe you were the president of an organization, and in that role, you did several, you held meetings and you kind of did your presidential duties. And then through that same organization, the following year, you were the philanthropy chair, and that involved a huge fundraising effort that ended with, you know, raising $20,000 for free clinics, and you really want to specifically highlight the efforts and the different skills you used as a philanthropy chair versus as the club president. That would be fine. I would list the experience, one maybe under leadership, maybe one under service. So think about ways that you can do that, and be clear that it's the same organization, but that it's a different year. So hopefully you'll be able to designate that within the data fields that you're listing in the AMCAS. But I do caution you against putting several things from the same organization into different experiences, because then it just looks like you're trying to, you know, spread all the food around the plate to make it look like there's really more there. The hourglass. So writing about research is tricky. You do need to give some thought to convey your ideas clearly and to recognize your audience. So not everyone who's reading your application is going to be involved at the granular level of the research that you might be doing. So do not use excessively technical language in describing, you know, research in the application. In the MD PhD, if you're applying MD PhD and you're writing a research personal statement, you might get to be a little bit more technical because the people who are reading it are going to be MD PhD folks. But in general, for, you know, regular MD applications, you want to be careful of doing this. So I'm going to talk about the hourglass. So this is how I think writing about research is effective. So you begin with a field of study, you give the sort of the research question and what it is that you are doing, you give your role in the study and how it fits into the big picture, then expected outcomes of those findings and implications, and then why do those things matter, right? So my example would be, I did research in the field of cardiology. We are studying the rates of tissue death during cardiac events in order to improve care. What I did in the study, right, my role in the study was to induce oxygen deprivation in cells of animal models at various time intervals in order to then count the number of dead cells in each one of those time intervals so that we could find out what the rate of tissue death was during something that would be like a cardiac event where there's oxygen is deprived from cells. So in doing this, we hope to understand what the sensitive time intervals are that impact how the rest of the body is going to function after some sort of, you know, cardiac event. And the findings of this will hopefully inform not only pharmaceutical interventions, but public policy around how far people should be living from a trauma center, or interventions that might be able to be made when someone's being transported to a trauma center that could help us eliminate negative outcomes from cardiac events for patients. Right? So very clear, and you could follow what I was saying even if you weren't a cardiology researcher. I don't need to know the specific enzymes. I don't need to know the kinds of proteins. If you begin this way and you write it this way and someone happens to be in that field and they're interviewing you, they might ask you more specific questions about it, but they'll be very confident that you understand what you're doing, what you're studying, and why it matters. And lastly, some challenges. So when you write about challenges or disadvantages, you want to make sure that includes taking responsibility for those things. You want to state facts, not emotions. If you're going to list these things in a disadvantage statement, being on public assistance or needing food assistance, not, you know, it was so grueling and difficult and hard, and every day was such a struggle. So it's not a place to really involve narrative drama piece, but really just, these are the reasons why I consider myself to be a disadvantaged applicant. Rather than saying, my grades would have been better if I hadn't had to work so much. You could say, you know, my performance academically was impacted by how much I worked, right? And that is a fact, not the, oh, they would have been better, I could have done so much more. Do not leave loose ends if you're going to discuss challenges, like, you know, a trauma that you've suffered and then not telling us if it's wrapped up, or a devastating diagnosis that you received or someone that you love has received, and then we don't know what the outcome is. And if you're including these things in your personal statement related to challenges or difficulties, they do need to be related to your motivation for medicine. Otherwise, you're sort of kind of parading hardship in front of the committee without a real anchor or connection to, why does this matter? Why does this matter for why I want to be a doctor? How is it changing what I'm bringing to medicine? How am I newly sensitive or able to connect with people because I've had this experience that's going to, challenge me and make things better moving forward. Okay, so this is my contact info. This is where you can find me. Most of you have this information already because you made it to the chat today, and just information about my upcoming book. Thank you for listening. Hope these tips were helpful, and we'll see you next month.